Hello, welcome to the University of Gloucestershire Epad tutorial. Today I'm going to take you through the Epad that we use for our students' documentation of their placements and show you all of the aspects of the Epad and how to navigate it. So I'm going to show you, there's various ways that you can access the Epad, but today I'm going to show you how to access it for the first time through Google using your logon. Quite often students may send you a link directly to their Epad and you will receive this via the email address that's associated with your account, which is usually your work or NHS email address. So I'm going to just log in to the Epad. So if we see here, we have a Google screen. So all you need to do is type into here, UOG, practice, support. It will be the first thing that comes up, and it's the University of Gloucestershire Practice Support. And this is a really good resource for all practice assessors and supervisors or teams, just for any information they may want regarding our courses, our programme, how to raise concerns, if you need any training. And the one we're going to go on today is ARC Support. So ARC is the platform that hosts the Epad. And when you scroll down this page, there's student access and clinical staff access. So you're going to go on access your student's Epad as a practice assessor. Now, for the purpose of this tutorial, I'm going to be using a test account, but for you, it will be your NHS or your work email address, and you should have been given a password as well. If you haven't used it for a long time and you can't remember it, if you click this box down here with the yellow bit, and it will give you a prompt to put in your email address, and it will send you a password to your email address that's associated with the account. If you don't have an account, please get hold of us at practicesupport@glos.ac.uk, and we will pass that on to the placements team to sort you out with an Epad account. So I'm just going to log in there. And this brings us to the Epad homepage. So this page is really good for information. Okay, so the main thing that we're going to use is this drop down section at the side here. So you can see when I click on it, at the moment we can't go on anything because we need to select a student, but I'm just going to go through this front page first. So there's lots of information on this page if you're not 100% sure on the different roles and responsibilities. So as you click on each section, you'll see they become highlighted. And there is a nice overview of the responsibilities of the student as per the NMC, practice supervisor, practice assessor, and academic assessor. Okay. If you aren't sure of these roles or you'd like to have a practice supervisor assessor update, that's also something we provide, and you can access that through the training section of practice support. There's also some guidance for using the PAD to facilitate learning and assessment, criteria for assessment, and our guidelines for assessment and progression down there as well. So if we go back, there is a prompt at the top here, but if you forget where you're at or where you need to be, just click on these three little dots in the corner or lines, and it will bring down the section for you, and everything you will need will be on this section. So if you have followed a link from your student, then you will automatically go straight into the part of their Epad that they would like you to fill out. If you have accessed it through the way we did today, you will need to go and highlight the particular student that you'd like to sign for, and they will be in a list here. Now, we do also have TNAs or SNAs, they're now called, so nursing associates and apprentices who use the Epad now. The only differences with that are a couple of extra things in the drop-down section, and I will remember to do that at the end and go through that with you. But for the purpose of now, we're just going to click on one of our students, so just make sure it's the right one if you've got more than one. And that will bring you to their placement overview page. Okay, so this student is currently in, we've got part 1 here. So the parts mean part 1 is year 1, part 2 is year 2, and year 3 is part 3. The reason it's now called parts is because we understand that sometimes students may take a break, or they might be in a slightly different cohort to where they originally started. And the part is a good way of seeing where they are currently at within their nursing journey. But it might be that they've actually been studying for sort of 4 or 5 years potentially in total. So at the top here, you have an overview of all of the placements. Okay, so it will tell you how that student is doing for that year. So this student is in part 1, just ignore the placement 5 bit there for now, this is a test account, but this student is in part 1, and currently for this year, the student has not yet submitted an episode of care, they've not yet been assessed on their medicines management, they've done 7 of their 29 proficiencies, and their OAR will be done at the end of the year. So it just gives you a little overview of where that student's at. If we look at this section just above, so grey, which is this background here, grey means they've not yet submitted anything. So if we go down to the bottom bit here, you can see that we've got green here, but this bit is grey. So it means that the student's not yet submitted it. So it's not for actioning from the assessor. It means the student still has something to do. If something is yellow at the background, it means that the student has done their part and the assessor now has access to it. If the background is green, it means that the section has been completed by the assessor. So we can see at this one down here, the background is green, so it means that the assessor has filled in their part. What that doesn't indicate is whether the student has passed or failed that item. So that would be indicated by the cross or the tick. So you can see at the top here, this section has been achieved and this section has not been achieved. The colouring of the background purely means whether they have completed it or not. So you can see for this person, they have done their midpoint interview because it's green, but the red cross indicates that they have not achieved it. So completed but not achieved. And then they have also then submitted their final interview to their practice assessor. So it is yellow, which means waiting to be seen by practice assessor, who can then go in and access that. So what we're going to do is just to have a look. If we pop into this placement, so you find your placement on there. Yours will normally be the top of the list if it's their current placement, but if for any reason you need to go back in, just make sure you're accessing the right one. And it will say the area host name there, and you can just click go to placement. That will then take you into an overview screen of that placement's documentation. So in this part, we're going to have a look at the various discussions and interviews that you need to have with your student throughout their placement with you. So the orientation is the first screen. So this one has already been approved by the student's practice assessor. But essentially it should be done within the first day, and it says that here needs to be met within the first day. And all it is a safety orientation of the placement area. So the student needs to be aware of the fire procedures, how to raise alarms if necessary, where they would find policy and procedure, and kind of general housekeeping really of where they may need to go, what's available to them. So providing they've been shown about, and that doesn't have to be by the practice assessor, that can be completed by any responsible member of staff. But as long as they've completed it, then the assessor or supervisor can sign that off as having been done. So once the student has received that information and kind of been orientated to the area, they will submit that. And then the assessor comes in and says, marked, and we'll mark it as seen and say, yeah, they've done that. So it's just a tick box. The student will send it through to you as a link, and then you go in there and say, yes, they have completed it. That will then unlock the initial interview. Okay, so the initial interview needs to be completed in the first week, ideally. Now, it doesn't have to be the practice assessor. So if the practice assessor is on holiday or is off sick or for whatever reason too busy, this can be done by one of the practice supervisors, but it's really important that that student has that discussion within their first week of what they'd like to learn, any needs that they have, any outstanding proficiencies, and also be informed of the learning opportunities available within the placement. So they will write a summary in here of what they'd like to do within the placement, what learning and development needs they have and what might be available. And then they will write an outline here of how they're going to achieve that. And again, that is written by the student and sent across, and the supervisor or assessor can sign that as having been completed. If you're not happy with it, or you don't feel that they've written enough, or they've written something that's completely inappropriate or unachievable, you can send that back and they can redo it. Once the initial interview is done, that will then unlock the midpoint interview. So all of these things are sequential. So you can't access one until you've done the one previous. So midpoint interview, we would recommend making a date for the midpoint interview within the first couple of weeks and planning that ahead, and give yourself a little bit of leeway just in case the student or yourself is off sick. Okay, so the midpoint interview, what you need to do here is have a discussion and reflect on the student's progress. Within that, you're going to have a look at professional values. Now, these are the professional standards that we would expect the students to adhere to throughout their placements to be showing that professional behaviour in accordance with the code. In order to look at these, you just click on each of the headings and they will expand. Now, this one's already been completed. So when we look at the final interview, you'll be able to see these parts on there as well. So this student in particular has not yet achieved confidentiality within the NMC code. So it might be that, you know, they answered the phone and did something incorrect, and they still have some learning and development to do there. So the assessor has said, no, not yet achieved. They have passed the rest there. And these are all kind of in accordance with the code. So it's all about non-judgmental, confidentiality, privacy, dignity. It's also to do with their professional behaviours and whether they're turning up on time, whether they're telling you that they're on shift or not, whether they're communicating appropriately, dressed well. And what we would ask is if the student is failing at any of these professional values, we would ask that you let the coach in practice know, which again is the practice support at glos.ac.uk. That's the generic inbox for the coaches, and we can come and support those discussions and in making an action plan for the endpoint. So all of those need to be completed, and they are just a yes or no. They're, you know, if they're not yet fully achieved, they have to be put as a no, but they can't just be left. The document doesn't will not be sent unless all of those boxes are complete. That then takes us on to reflection of progress. So the student will write in these boxes and they should reflect on the knowledge that they've gained, any skills that they've performed or are developing, and their attitudes and values and how they're upholding those within the placement. The student should ideally submit this document prior to the midpoint so that you can access it and have a look at it together during the conversation. Occasionally that's unable to happen for whatever reason, and it might be that you have that discussion and go through everything and then fill it in afterwards, but that's up to you. But we would suggest doing it in person at the time together. The practice assessor will then write their part in there as well, and it might be that you'd like to write a little plan here of any kind of gaps in their learning, and actions you'd like them to follow up. So for example, spend a day with a specialist member of staff in order to gain this proficiency, and they can go in there as well. But you would then submit that and send it back to the student and they can see that. And again, if you're worried that the student is failing or is not, you know, hasn't met any of their professional values, please do let the coaches in practice know so we can support you. The other thing you will want to look at midpoint is start having a look at the proficiencies and see if the student has completed any of those, and we'll have a look at those in a moment. But I'm just going to show you the final interview document before we move on there. So the final interview looks very similar to the midpoint. But this time, when you click on the professional values, you will see what the student achieved at midpoint, and then we'll need to fill in the final ones. So hopefully by the end of the placement, these will all now be a yes. If they are not, if they're still at a no, it means that the student has failed that placement, which is why we would want that support in place at midpoint if they have failed anything. So you go through all of those. Again, the student needs to reflect on one of their professional values. So they will write a reflection in here about one of their professional values. It might be one that they failed at midpoint and would like to demonstrate how they've developed their practice with regards to that, or it could just be one that they know that they've done particularly well or struggled with. And then they'll reflect on their progress as well, and so will the practice assessor. If there's any learning and development needs you'd like them to kind of work on within the next placement or highlight to the next placement. So you're happy that you might be really happy that they've passed, but actually they're just not that confident yet and you think they need to work on that a little bit, or taking initiative, or those can be some really great things to pop in this box, and then the next placement can have a look at that to see where they might need to work more on. You then save and verify that and it will submit that. If you're not happy with what the student's written or they've written something that's not correct, you can send it back to them, and there will be a box in there to highlight what it is you'd like them to do. The OAR will be at a tick box basically at the end of placement. So at the end of placement there will be a placement OAR, and at the end of the part, so the end of the year, there's also a part OAR. And what this is when you click on it, you can see the interviews from placement on there, and it will let you have a look at what you need to. And then when you scroll down, you are going to be, this will toggle automatically based on what they've completed. So if they've completed everything correctly, this will say yes. Have they achieved the professional values in this placement? Yes. You could write a final small comment in here for any areas for developments and any strengths that they have. And what that does is just ticks off that placement or that year for them. And that's a bit that quite often gets missed because it's just a small kind of tick box at the end. Timesheets are done slightly separately, but they will be listed on here just to kind of show an overview of them. The students will fill in their timesheets and send you an email link, and you will confirm or reject and send them back each week. So if we have a look in this section again, so we've selected our students and now all of these areas are happy for us to click on. So we've had a look at the placement overview. So we're now going to have a look at assessment of proficiencies. So we've got part 1 here. If the student is in year 2 or 3, there will be other parts at the top. So it will take you to the current one that they're in, but you can have a look back on what they've done previously as well. And there is guidelines box. Now this guideline box gets forgotten all the time, but with every section on our Epad where we're expecting the students to do something, there are guidelines on there for you and them. So it just explains a little bit more about what it is that they're doing. Now currently the students do simulation sessions at university and they input the dates, and it will transfer some of those into simulated proficiencies on here. Now not all that will be changing, so not all students will have that going forward, but if you see a green box on there which says simulation, so at the top here it will say simulation, that means that they've done it in university and it's being ticked off by whoever has done that with them, and that means that they have passed the proficiency and that we're happy that they've done it in a simulated environment. So if they can do it again in practice, that's amazing, and we would encourage that. However, they do not need to in order to pass the proficiency. The simulation would be deemed enough. So if we just have a look at this screen. So currently the student has got 24%. So they have 7 out of their 29 assessments for the part. Now, the students need to complete at least 50% of their proficiencies in the first placement of the year, and then the remaining in the second placement of the year. And if they don't achieve 50% at least, they will fail the placement. So this percentage is quite important to keep an eye on, really. And what we want to do is make sure that if it's the first placement of the year, they've achieved at least 50%. So it's good to have a good look at this at midpoint and see whether there's any you can already sign off, or at least discuss and make a plan to sign off for the endpoint. So just with the professional values, you click on each section, it will drop them down for you. But unlike the professional values, if the student hasn't had an opportunity to do this, to have a go at this proficiency, we would ask that you don't fill it in. So unlike the professional values where they have to be upheld, with these, if the student's not had an opportunity to do it, we wouldn't mark it down as a fail. We would just leave it blank for the next placement. If they are in the second placement of the year and there is no opportunity for them to do that proficiency in your area and they have not yet completed it, the student will need to arrange an experience with another team or a member of staff who can give them that experience and feedback to you in order to sign off that proficiency. So when we have a look at the proficiencies themselves, just be really mindful of the words that are used. So if it says demonstrates an understanding of a person's age and development in undertaking an assessment, so that doesn't necessarily mean they have assessed somebody in all ages and fully understand everything. What it means is they can demonstrate understanding of how the age and development will affect the nursing assessment. And it might be that sometimes some of these are met through discussion. Sometimes the students might do a piece of work, and other times it can be question and answer, or and sometimes it will be practice observed. But really carefully look at the wording that they've used at the beginning of each proficiency, because sometimes it's more about the students demonstrating their understanding and having that knowledge there should they need to use it. If it doesn't explicitly say the student has practiced this under supervision. So some of them do say the student needs to have done it. Sometimes it says demonstrate the understanding or can show knowledge of. If you're happy that you've done that proficiency together with the student and that they've passed it or failed it, you click on this box here. You can either put in the date that the student did it, or you can just put in the date that you're doing your midpoint. So today's date. You would toggle for yes or no. So if we say yes, and then save, and that will bring up an assessment for you here. And when you hover over it, it will have your name on there as the practice assessor. If you've made a mistake, you should be able to delete that. And if you actually think the student's not achieved it, you press no. So that would be, for example, if they've had a go at something, they've not done it safely, or they've not really applied the evidence-based knowledge that you think was required there, or they've not quite done it to the standard you would expect, and you actually think, do you know what, I've assessed that and it's not at the standard we need. You could mark them as a no currently, and it will come up with this. Now, even though they've done this before and they've got green ticks before, the fact that they have a current red cross means that that assessment is the most current one, and therefore they have currently not achieved that proficiency. So they would need to redo that again over the following weeks and get their green cross again, and that would come in afterwards. I'm just going to delete that for now. And if I take this one off here, you can see that we now have 28% completed, and we have 8 out of 29 assessments. So it will change this percentage up here as you're filling it out, so you can see it nicely. And again, back to 24. So you do that for each of the sections. There's quite a few in there, but they can be done at any time throughout the placement, and they can be done by supervisors or assessors. Doesn't have to all be done at mid or end point, but it's just a good time to have a look at them and see whether that is whether they're on track or whether it's something that's needing focus. So if we go back to that main menu in the corner, we're going to have a little look at episode of care. So the students will have an episode of care that they need to complete throughout the year. First years will have 1 episode of care to complete throughout the year, and second and third years will have 2 episodes of care, so 1 per placement. Each episode of care is slightly different, and they all have some guidelines on there, so you can have a really good look and work out what it is that needs to be done. Now, what an episode of care is a piece of care that the students are going to participate in with a patient or as directed in the guidelines. And it's an episode of care that they have performed with a patient under supervision from their assessor. They're then going to reflect on that and write a reflection about it, and the assessor's going to add their comments and agree as to whether they've covered the points listed below. So for this one, for first year, it says the practice assessor and student will identify an appropriate episode of direct care involving meeting the needs of a person or family receiving care. And then they need to ensure that they've covered these 5 points here and the learning outcomes below. So even if they haven't necessarily covered every single point within the episode of care that they did, within the reflection, we would expect some sort of reference to how they considered those things within it. Now, they do have a formative and a summative submission. The formative is optional and it can be used as a practice. So if a student's in their first placement, we would usually encourage them to have a go at doing a formative one, which can be signed by a practice assessor, and then maybe in their second placement doing the summative one. Many students choose not to do the formative one, and that's okay. But if they fail the summative, they fail the placement. So the student will fill out these boxes here. So they're going to, it's quite a simple reflective plan on there. So within your reflection, describe the episode of care and how you assessed, delivered, and evaluated care. What did you do well and what could you have done differently? So we would expect a decent chunk of writing within these boxes. Sometimes students will send in one line, which is not a detailed enough reflection, and they can be sent back. So if you're not happy that actually they've covered everything that they did, or not enough in depth, then you can send it back and ask them to rewrite it. So if we think about this one here, so practice assessor and supervisor and student will identify an appropriate episode of direct care to meet the needs of somebody receiving care. So it could be that they've done a set of observations, they've assisted with a wash, they've helped a patient have their dinner, helped with some feeding, anything that would be direct care. So you can apply that to any placement area. If you're not sure what to do, you can again ask the coaches in practice through the practice support inbox, and we're more than happy to help you and go through that with you. So once the students filled in their part, they will then send this to you for some feedback. Now you need to click yes or no on these boxes, but what we would recommend is if they haven't got it, so if it's a no, reject it and return it to the student and give them that opportunity to complete it again and maybe give them some direction as to what it is they've done wrong. You need to write a comment in here in order to continue, or it won't let you mark it as complete. You have to have written something in that box, and it might just be achieved or did well or yes. It doesn't have to be thorough, but it needs to just have something in that box. And then once they have got a yes in all of them, save it and mark it as complete. Now, obviously, if the student's on their final day and they've hurriedly written one and submitted it, and it's not achieved the standards of the proficiency here, so these 5 things, and you're on your final day and you have no opportunity for them to improve that, then you would have to mark it as complete and just put no in these boxes. But the students are given adequate kind of warning of that these are due in, and they should know that these are due in good time for the year. Any questions on episode of care, please do come to the coaching practice, but essentially they are a reflection on some care that they've delivered with their assessor, and the assessor's then going to sign that off. So the next thing on the list is medicines management. Again, there are some guidelines at the top here, which kind of go through the learning outcomes of what the student is able to do. This will be done once per year. Okay, so if they are in a placement area where you do lots of medicines and it's their first placement, if they have done their Safe Medicate at university, they are able to have a go at doing their medicines management if you think they are ready. We quite often might suggest leaving it to the second placement. However, if they end up in an area where, if it's a community team where they don't give many medicines, or a clinic where, pre-assessment where they might not actually give medicines, it can be quite difficult and they'll need to arrange some time elsewhere. So if you're in a placement area where you're doing medications and you're happy that the student's doing it really well and you can go through the form with them and they're going to pass, have a go at this. So submission 1, again, there is a formative and a summative, and we would strongly recommend the students to have a go at doing the formative one, at least in the first year, to kind of give them a practice. And it will ask here why the formative wasn't done. So it is a competency, and you have to write yes or no to achieved. So if you're kind of part way through the placement, the student has said, I want to do my medicines management, but you don't think they're yet ready, and you know that they're going to achieve a no on some of these items in the competency form, then please have that discussion with them and just say, look, we're not ready yet. You're going to fail it, because once this is submitted as failed, it will fail the placement. You can go back in and edit it during the placement, but we'd have to get that revoked. So once you've submitted it with a no on there, it's marked down as a failed meds management on the Epad and will therefore fail the placement. So we only advise doing this once the student is has completed their Safe Medicate at university and they're happy, and you're happy that they're ready to do it and they can achieve all the parts of this. It doesn't have to be a full drug round, and it could be done over a number of various times that you've given medicines that encompass all the parts of the competency. But it might just be, we know how busy drugs rounds can be. So it might just be that you're happy for the student to be assessed on that one patient's medications. And as long as they've administered medicine, if there's any parts of this that you haven't actively done together throughout that kind of assessment of that giving the medicines, it can be achieved through discussion and question and answer. So you would have to ask it or simulate it and ask what they would do in that scenario, and then put yes or no. Obviously, if you're toward the end of the placement and it's the second placement of the year and the student needs to have this done, if they fail it, they fail it. That's absolutely fine. We can only put yes if we're happy that they would know what to do. And then you can write as much as you want in the box below to give feedback, and then save and submit. Again, any questions, please do ask the coaches in practice, but the students all know this Epad quite well as well, so they can help to direct with that. So the next part on the drop-down box is cross-field experience. Now, cross-field and experience and interprofessional working are very similar, but they are areas where the student can upload, and there are guidelines in here again, so that it's working and learning from other interprofessionals or other members of the MDT, and they can upload proof of having worked with other members in here and any feedback that they've got. So the next part of the Epad is the communication section. So we mentioned an action plan earlier on, but if a student has failed a professional value, we would ask that the coaches be involved, and we would pop an action plan in place to help them identify what's expected of them for the end point. And an action plan can be done for a number of reasons. So, if you have issues with professionalism, or the student really needs to work on their knowledge in a certain area in order to be assessed, or a proficiency they're particularly struggling with, these can be a really good tool to help. So in order to put the action plan in place, you just click Create New Action. A nature of concern, you might say professional value not yet passed, and then you might type which professional value it is. Student needs to demonstrate, and then you're going to list in there what they need to do. So student needs to communicate effectively when unable to attend placement, and be specific. You can say phone ward and speak to nurse in charge, and then that student's going to be aware of this action plan, agree to the action plan, and if they are not phoning the ward, speaking to the nurse in charge when they're unable to come in, and then they're just being off without any notice, they have then failed the action plan, and that is something we can monitor throughout the rest of the placement, and we would like to see significant improvement with that. Support available, so we've obviously got the practice assessor, coach in practice, and staff team. So anybody that's going to help that, and student responsible for communicating. So you can keep it really simple. You can use it, you can be as in-depth or as simple as you'd like it to be, but as long as it really clearly shows that explanation and expectation to the student. And then they need a good few weeks for an action plan. So if you're having your midpoint very close to the end of placement, that can be quite tricky because the student must be given feedback in a timely manner. So always make sure that you're having it kind of halfway through, so the students have a good month or so to show improvement. And then you just press submit. You'll get a little smiley face up there, which will say successfully added. And you can see this one is currently showing as red. So that one's still outstanding. I'm just going to delete that one for now. and you can click on there to look at previous action plans as well and mark it as complete. So you can just click on this box here, mark it as complete, and you can write a comment in there once they have completed it. And if a student has passed a placement, please go in and put any existing action plans that are still in place, change them to green, because the student shouldn't be passing a placement unless all the action plans have been achieved. So that's the action plan. The other section that's really great in here is record of communication. So what we really would like at the University of Gloucestershire is nothing about the student without the student. We'd like them involved as much as possible in all communications about them. So ideally, we won't be having lots of emails sent to the coaches, not including the students, to discuss them and their progress. We'd really like it to be an open channel of communication between the student, the coach, and placement. We understand that at times there are sensitive things that need to be discussed, in which case that would be absolutely appropriate. But ideally, what we would use is the communication log within the Epad. What this also is a record of your support for that student. So if you've got a particularly tricky student and you're having to give them lots of feedback, have lots of discussions, I would summarise those within this communication log, because as with patient documentation, it's a really good way of evidencing the support you've given for that student and the conversations you've had. So what this is it is an email service, but it also will document everything within the student's Epad. So the student can see everything you write on here, and so can anybody else that has access to the student's Epad. So we shouldn't be writing anything confidential or particularly sensitive. And it should be professional, and it shouldn't be a surprise to the student. It should be kind of summarising conversations you've had in person, and maybe just copying in the coach so that everybody's involved. So you can write whatever you want to in here, and when you click on the recipient, you can either write something to the student, the academic assessor's often in there, and the coach in practice you can send it to as well. And then what that will do is it will send an email saying you have an Epad message and show a summary of the Epad message, but you can't respond through the email. You have to come back into the communication log to do that. So I can just, and then it shows like this. So academic assessor sent Fred Test a student email here. Hi Fred, please get in touch regarding shifts. So it could be a number of things you want to speak to them about, or it could be summarising conversations you've had, or checking up on them, or seeing where they are. And copying the coach in is a really good way of keeping us in the loop of what's going on with their placement. We will keep an eye on the Epads as well. And if we notice that the midpoint is overdue or nothing's been filled in already, we will communicate with you via this communication log and send a message just asking if everything's okay and if you need any support to you and the student. So the other thing I want to show you is, so there's a feedback section that the students can upload any feedback they've been given. So that can be a really good evidence for them of having achieved things. And the other thing I want to show you is performers to print. So if you're in an area where you don't always have access to the computer, or you like to have a paperwork document of things, or perhaps you're going out with the student out and about and you don't have access to the Epad, all of these things in here are printable versions of everything we've just gone through. So there's the episode of care, medicines management, the proficiencies. So if we have a little look at the medicines management, it looks quite different to how it did when we looked in there, but it is a competency tick box so that you can take that out, reference it, and then fill it in on the Epad afterwards. It can be really useful to just print that off. And also if a student's in an area where, for example, they might be in a stroke assessment team in a community and they don't give medicines, they might spend a few days on the stroke ward in the associated hospital where they've done their medicines, and they might take this with them and get it filled out by the practice assessor that they've worked with, and they can bring that back as evidence to their practice assessor in their placement. So those are all on there and they're really great. So you can print all them off and use them as reference, or if you want to fill anything out on paperwork, if you haven't got access to the Epad. So the last thing I'm just going to do is have a look at the SNA part. So this is the TNA test student. So if you have SNAs or TNAs, it's very, very similar. The only real difference is a couple of things in the drop-down menu and how the front page might look. So you can see here, we've got base placement and away placement. So they will have sections of the Epad when they are on their base placement. So that's where they're normally employed for the duration of their apprenticeship. And then when they go away on their spoke placements for 5 weeks, they will have a separate bit here that they need to fill in while they're there as well. They will still have the overview of their proficiencies, the episode of care and meds management like the other students do. And the only other real differences down the side are they will have record of statutory and mandatory learning, which when we go on there, it's just going to be a record of when they've completed things. And these are submitted by the student and uploaded in there as kind of a portfolio of evidence. And the other thing is their record of PLT, so protected learning time. And they can enter those in there as well when they've done them, and they can be approved by their assessor. So that's any kind of supernumerary time they've had where they've done things out of their usual role to aid their learning within their nursing associate programme. And they can be, and then it keeps a nice tally here as well, because PLT can be quite hard to figure out sometimes. So it's just a good way of the students doing that. So that is everything I wanted to show you today. Thank you for coming. This can just be accessed anytime. And yeah, if you have any questions, please speak to any of the coaches at practicesupport@glos.ac.uk. Thank you very much.